Every few days people ask me, Dr. Kwiatt, how should I whiten my teeth? And I tell them, well, there's all sorts of ways, as you can see here. These are all over-the-counter products that you can buy at your local drugstore, pharmacy, Target, and then these are the products that we like to use here in the office. The way you whiten your teeth depends on how long you are exposed to the whitening solution and how strong it is and how closely it adheres to your teeth. So those are the three different criteria for whitening your teeth. So we have the toothpaste here, which claims to whiten 6 times, but 6 times whiter. But I've got to say, if it's only in your mouth for a minute or two, it's really not going to do a lot. Next we have the very popular Crest white strips. They have a fairly high concentration of the whitening material, but let's take a look here. You open the packet, and there are these thin strips that are to go on your teeth. So you have some teeth here to try to demonstrate it with, and you peel this off, if I can get it. And then it's almost like a piece of Scotch tape with the whitening material embedded in it, and then you put it on the teeth and kind of wrap it around, and it stays on. And as you can see, it's hard to get it positioned just right, and it's very thin, and it's kind of like tape, and it folds up on itself. So if you can do it, it can be an effective way, but you can also imagine that there's not a lot of whitening material embedded in this thin strip. So, you know, this is one of those things that I would recommend for someone like maybe before their prom or something, they want to look good in a picture. This can be effective for people who don't have heavy skins. But like I said, it's hard to make it stick, and you can see how it crumples up even when I took it off. So that's like kind of it can be good, but a difficult way of doing it. Next we have these trays that come from the pharmacy, and you get one upper and one lower, and you take them out, and then you take this material and you pour it in here and you stick it on the teeth. And again, it's kind of a one size fits all, and you can see here that it doesn't even cover completely the whole extent of the tooth. So the other thing about this is it doesn't fit real intimately to your teeth, so most of it's just gonna flow out of there, and you'll have to wipe it up or spit out the excess. So those are the basic over-the-counter types that you can use. Now, these are the types that we use in the office. This one is called the Opal Go strips, which is similar to the strips, except they're much thicker, and they have a higher concentration of the material. In this case, you can see the tray here, and what you do is you take the tray and you put it in your mouth, and you kind of push it on your teeth and kind of suck down on it, and then you take the tray off, and you can see this strip, which is much thicker than the Crest strip, adhering to the teeth and pretty much covering the whole tooth. And you do this for between 30 minutes and 2 hours, and we have a 5-day supply or a 10-day supply, depending on how much stain is on your teeth. So this proves to be a pretty effective way, and also because of the thickness, I'm going to take this off, you can actually see the thickness of the material coming off here. I mean, it's like a real heavy gel, and works well on staying on the teeth, not moving around. And then we have my favorite way of doing it, which are the custom trays that we make here in the office. And what we do is we take impressions of your mouth, make plaster models, and then we have this blue material that we place onto the model. And that blue material is actually the same thickness as this gel that we had before. And then what we do is we load the gel into the tray, and then this is put on your teeth in your mouth, and you push it on, and most of the material stays in the tray because there's space for it created by that blue spacer that we've done. And you can wear this anywhere from an hour a day to, you could wear it overnight if you like, while you sleep. The longer the material is in contact with your teeth, the whiter they will get and work pretty fast. The other nice thing about this material that we use is that it contains fluoride and materials to make your teeth less sensitive, because if you put some of these materials on, even the white strips, and your teeth are sensitive, they'll become more sensitive. Now that usually goes away with a little time, but that is one of the aspects of whitening that is, some people have some sensitivity. Now, the other nice thing about this tray material is these trays last for a really long time. So if you whiten your teeth this year and then you think, oh wow, they're getting a little dingy again, I've been drinking too much iced tea or coffee or red wine or whatever, you can purchase some more whitening material to put in here, and usually in about 3 days of wearing the trays again, your teeth will whiten up to where they were after your initial whitening session. And then lastly, we have two other ways of doing it that I call our quick methods. This is the Philips Zoom. This is used with a light to activate the whitening material. This whitening material is much more concentrated than any of these others, either the over-the-counter or the opalescent. And so for that, you are in the office for about an hour and a half to 2 hours. You sit in front of the light. Several applications of the material is put on to whiten, and this material is very, very strong. We have to protect your lips and cheeks and your tongue and your gums, because if it gets on there, it can cause a little burning sensation that nobody seems to like. And this involves a kit. If in a year or 6 months you want to whiten again, you would have to go through this whole procedure. This is the most costly procedure. And then we have an alternative to that, this opalescent boost, which also is a one-time 1 hour application. And actually in this, there are 2 different whitening gels that are mixed together in a syringe and placed on your teeth. Again, this is very caustic, very high concentration, so you have to protect the gums, the cheeks, and the lips, and you don't want to get it on any of those or it will cause a burning sensation. So that pretty much summarizes it. As you can imagine, this method works rapidly, 1 to 2 hours. Really dramatic change in that 1 to 2 hours. This costs about in the $500 to $600 range. The custom trays, which are reusable, and all the materials that go with it are about $325. The 10-day supply of the Opal Go is, I think, about $100. And believe it or not, these Crest White strips cost about $35, and this costs about $25. The bad thing about this one is it's only 3 days supply. At least with the Crest White strips, you have about a 10-day supply. If you have any questions, you can go to our website and, or email me at Dr. Kwiatt at duffyandkwiatt.com, and we'll be glad to get back to you and answer your questions. Have a good day. Keep smiling.